All right. Hello. Good morning to everyone. Good afternoon or good evening, depending on where you are joining us from. And thank you for joining us for this press briefing this lovely Thursday morning. My name is Wayne Musabayana. I'm head of communication at the African Union Commission. And with us today is Dr. Ahmed Ogwell, who is the Deputy Director of the Africa CDC, and he's actually the acting director of that institution. To take us through the information on the status of COVID-19 across the continent. So he will provide that regular update on COVID-19 pandemic, as well as the vaccine delivery situation across the continent. He will talk on some emerging changes in some of the regions on our continent. And then he'll also touch on other key aspects of the pandemic as member states of the African Union gradually shift their public health and safety measures to cope with the post-pandemic era. So that's quite a lot that he has to get through. And today we need to do our briefing and conclude in 45 minutes. And that is because the acting director has another appointment at the top of the hour. So please, colleagues, do prepare your questions so that as soon as he's done with his initial briefing, we can then dive straight into your question and answers. And to send those questions, utilize this WhatsApp number, +251 94 550 2310. That's +251 94 550 2310. Alternatively, and as usual, we will be happy to hear from you live on this platform, as well as take your questions through the question and answer section. All right, so let's dive straight into our briefing and invite Dr. Ahmed Ogwell, the acting director of the Africa CDC, for the briefing. Ahmed, you have the floor.
Thank you. Thank you very much, Madam Wayne, and good morning, good afternoon, good evening, wherever you're joining us from. I would like today to share with you some updates on the COVID-19 situation on the continent, and then we will touch on monkeypox, since this has become quite topical, and some brief intervention on the World Health Assembly here in Geneva, as well as the World Economic Forum annual meeting in Davos. So as of today, the 26th of May, African Union member states are reporting a total of 11.6 million confirmed COVID-19 cases. And this accounts for 3% of the total cases reported globally. In terms of recoveries, we have a 94% recovery rate, with 10.9 million people here in Africa already recovered from COVID-19. Unfortunately, 253,000 deaths have been reported cumulatively, and this gives a case fatality rate of 2.2%, and the deaths in Africa account for 4.1% of the global deaths attributed to COVID-19. 5 countries in Africa account for 61% of all cases that have been reported on the continent, and that is South Africa with 34%, Morocco 10%, Tunisia 9%, and both Egypt and Libya at 4% apiece. During this week, 36 countries on the continent, which is about 65% of our countries, are reporting a case fatality rate that is higher than the global average. 2 countries, Somalia and Sudan, are reporting case fatality rates that are higher than 5%. 96% of our countries on the continent have already experienced a third wave, while 37 countries, which is 70% of our countries, have experienced a more severe third wave. Since the last briefing, no additional countries have experienced a third wave. 47 countries in Africa, which makes up 86% of our countries have experienced a fourth wave. And 31 of those, which is 66%, have experienced a more severe fourth wave. Since the last briefing, no additional member states has experienced a fourth wave. However, 14 countries have experienced a fifth wave, and 7 of those 14, which is 50%, have experienced a more severe fifth wave. And since the last briefing, 1 additional country, that is Namibia, is actually experiencing a fifth wave. 1 member state, Mauritius, has experienced a sixth wave. Now, when we look at the situation of variants of concern, 49 countries have now reported the Alpha variant, and there is no additional country that is reporting this variant from our last briefing. Similarly, 45 countries have reported the Beta variant, and no additional country has reported this variant since the last briefing. 50 countries are reporting the Delta variant, and no additional country has reported Delta variants compared to the last time we did this briefing. 3 of our countries are reporting the Gamma variant, and since the last briefing, no additional country has reported this particular variant. 48 of our member states are now reporting the Omicron variant, and there is no additional country that has reported this variant since our last briefing. When we look at the period from November last year to date, 16 of our member states have reported the Omicron BA2 sublineage. When we look at the trends over the last 1 week, we are looking at week 20, which is 16th to 22nd of May 2022. And when we compare that week 20 with week 19, we are seeing a total of 46,684 new cases were reported in Africa, and this is a 21% decrease from the previous week. The highest proportion of the new cases are largely from Southern Africa, making up 95%, while the other regions, Northern Africa, 2%, Eastern, Western, and Central Africa regions, each having 1% of the new cases reported during epidemiological week 20. Of the new cases reported during this EPI week, the following 5 countries are reporting the highest numbers of new cases. And that is South Africa with over 38,000, Namibia with just under 2,000, Zimbabwe with 1,400, Morocco with just over 800, and Tunisia with 673 cases. The following 5 countries are reporting the highest daily incidence per million population. Botswana at 2,504, Namibia at 105, South Africa at 89, Eswatini at 54, and Cabo Verde at 14. In terms of deaths, a total of 278 new deaths were reported in Africa compared to 308 from the previous week. And this represents a 10% decrease in the number of new deaths compared to the previous week. Now, let's look at the epidemiological trends over the past 4 weeks. New cases, there has been an overall 36% average increase when we compare the last 4 weeks to the previous 4 weeks. And the following regions have reported during this new 4-week period as follows: 40% increase in Southern Africa, 40% increase in Central Africa, 23% increase in Eastern Africa, 17% increase in Northern Africa, 14% increase in Western Africa regions. In terms of the most populous countries, the following is the breakdown. Nigeria, 34% increase. Ethiopia, 33% increase. The DRC, 33% increase. Kenya, 26% increase. South Africa, 19% increase. And Egypt, 69% decrease. In terms of deaths over the last 4 weeks, there has been an overall increase of 26% in new deaths being reported in Africa. Breakdown by the most populous countries is as follows. South Africa saw a 32% average increase in the number of new deaths. Egypt, 53% decrease, while DRC, Ethiopia, Kenya, and Nigeria reported no change in the number of deaths during that 4-week period. In terms of testing and medical supplies, to date, over 108 million tests have been done for COVID-19 across all Africa Union member states since the beginning of the pandemic. 1.5 million new tests were reported for the AP week 20, that is 16 to 22 May 2022. This reflects a 212% increase from the previous week when only 513,000 tests were reported. Cumulatively, the positivity rate is 11% and the test per case ratio is 9.2%. During AP week 20, the positivity rate is 3% and the test per case ratio is 35, which is a decrease in the positivity rate and an increase in the test per case ratio compared to the previous weeks, respectively. 5% of our member states, and that is 3 countries, Eswatini, Namibia, and South Africa, are reporting a test positivity rate that is higher by 12% during this week compared to last week. Let me give you the COVID-19 vaccines update now. As of the 25th May, our Africa Union member states are reporting as follows. The total vaccine doses supplied to Africa so far is 812.4 million doses. And these have been donated or procured by 54 of our member states. The total vaccine doses that have been administered across all the 54 countries is 572 million, which corresponds to 70.4% of the total supply that has come into Africa. Overall coverage of the population that are fully vaccinated is 16.9% as of the close of business yesterday. The following 10 member states have vaccinated more than 35% of their total population. Seychelles at 80.6, Mauritius 76.5, Rwanda 62.6, Morocco 61.7, Botswana 61.2, Cape Verde 55.2, Tunisia 52.7, Mozambique 42.7, Sao Tome and Principe 40.0, and Lesotho 37.6. We update these numbers very regularly, and you can find the updated ones on our website. Eritrea still remains the only African Union member state that has yet to provide the information on COVID-19 vaccine rollout. Let me also add an update on monkeypox. This has become quite topical now. Although we are seeing over, I think, 24 countries now reporting cases of monkeypox globally. In Africa, we have documented from 4 of our member states, and these 4 countries actually have endemic monkeypox. And so it is an illness that we continue to deal with as the outbreaks come and we control them. And the 4 member states are Cameroon, Central African Republic, the DRC, and Nigeria. 2 other countries are investigating suspected cases, and that is Morocco and Sudan. So when we look at 2022, the cumulative number of cases of monkeypox on the continent is as follows: 1,405 cases, 62 deaths, which gives a case fatality rate of 4.4%. And again, as I said, these are found in those 4 countries that I have given. As Africa CDC, we have provided guidance to our member states on increasing surveillance for monkeypox, establishing laboratory diagnostic capacity so that it can be easily lab diagnosed, expanding the knowledge of monkeypox amongst the clinical teams, and of course, putting in place infection control, prevention and control measures as they engage with the communities that are at risk. For members of the public, we urge anybody who has symptoms to quickly seek medical attention. Indeed, the washing of hands is very important because this is a contact spread disease. So washing of hands, keeping your sanitizer in use, avoiding touching animals that look sick, indeed, avoiding being in touch with animals that are known to be carriers of the monkeypox virus is highly encouraged for members of the public. And if anybody is found to have such symptoms, and quick medical attention is advised. As Africa CDC, we have established structures within our emergency operation centers on food alert mode to closely monitor the situation, not just globally, but particularly here on the continent, if at all we'll see a change in numbers or indeed change in countries where this is occurring. We are in very close touch with our counterparts in European CDC and the US CDC. Indeed, all other countries outside of those 2 areas that have reported suspected or confirmed cases. And we continue to engage and coordinate with our member states to ensure that information is flowing well across the continent and beyond. As I'm here at the World Health Assembly in Geneva, there's a lot of discussion going on around pandemic preparedness, looking into the future. And one key theme that keeps on recurring, apart from the many accolades that Africa CDC is receiving, is the need to strengthen regional preparedness and response plans and activities. And we are very happy to see that, because this has been one of the key messages that Africa CDC we are giving to the world. At the same time, we have the annual meeting of the World Economic Forum in Davos. We participated the whole day yesterday, different session, where the key topic being discussed is manufacturing on the continent, and which are the best options to ensure that Africa gets its local manufacturing, not just of vaccines, but all other health products that we use in health emergency preparedness and response. And finally, this is again the week that the Africa Union has called an extraordinary summit on humanitarian affairs and illegal change of governments across the continent, and that is being held in Malabo in Equatorial Guinea. And there we have 2 side events as well, with our partners looking at the role of the community health workers in universal coverage and health security, and also another one on finding innovative solution to humanitarian health crisis across Africa. So it's a full week for Africa CDC, and we are glad that you also have made time to be able to join us to discuss the health security situation on the continent. Back to you, Wayne.
Thank you very much, Ahmed. That was Dr. Ahmed Ogwell, the Acting Director of the Africa CDC. All right, let's dive straight into your questions. And the first 3 that we have are all on the monkeypox virus. So let's start by saying hello to Laura Lopez Gonzalez. And Laura is an independent journalist. She says, how many African countries in which monkeypox is endemic have access to smallpox vaccines? So that's the question from Laura.
No, thank you, Laura. Endemic currently is 4, the 4 that I've given earlier, and all countries have access to smallpox vaccines, not in the rate and the quantities that we would want, but they do have small stockpiles to be able to give at least to the health workers in the affected areas. We are working with these countries to see how to expand availability of more vaccines as may be required.
Well, thank you. It's hello now to James Chege-Macharia, who is with Reuters in Johannesburg. He says, I have 2 questions on monkeypox. The first one is, are there any African countries that are stepping up the testing and surveillance of monkeypox? And then the second question, what is the view of the Africa CDC regarding the use of vaccines for the containment of monkeypox? If vaccines are needed, is there any concern of possible vaccine hoarding by European countries? And I think James is referring there to what happened at the beginning of the COVID-19 pandemic.
No, thank you, James, for always asking very provocative questions, very, very well received. In terms of surveillance, we are working with all our member states on the continent to step up surveillance for monkeypox. Those that are around the endemic countries are, of course, at a much higher alert, but we are working with all countries to step up their surveillance for monkeypox. Indeed, yes, one of the key tools in this outbreak is the use of vaccines, and we are using the smallpox vaccines, which gives very high protection. But we can't tell whether there will be hoarding or not. We hope the availability of vaccines will be based on where the risk is higher rather than who has access to it in terms of purchase and the manufacture. So our message here as well is still the same. Vaccines should go to where it is needed the most and equitably so, based on risk and not on who can be able to buy it. So we are looking forward to a situation where the COVID-19 hoarding episode will not be repeated in this situation.
All right, thank you. Good morning to Coletta Wanjohi. Coletta, please go ahead. Hello, Coletta.
Yes, Madam Wan, can you hear me?
Yes, we can hear you. Please go ahead.
Okay, good morning, Madam Wan. Good morning, Dr. Ogwell. Good to see you. My question is on the issue of manufacture of COVID-19 vaccines. We know some countries like South Africa have already set up plants. Other countries are looking at doing the same. But we saw the president of South Africa recently raising concern that there seems to be very low demand for vaccines that are being manufactured in Africa. Are we moving to a point where maybe we might have very many countries with manufacturing plants for COVID-19 vaccines, but no one to buy? Is that a concern that maybe Africa CDC is looking at? Thank you.
Thanks, Coletta. It is a very big concern that we would have facilities manufacturing a health product, and there is need, and indeed there is a market for that health product here on the continent, and that product is not being purchased. This is a situation that we would like to avoid because it has very huge ramifications for public health and also for Africa's ambition to manufacture its own products. But we are doing something about it. And where COVID-19 is concerned, part of the discussions we were having in Davos yesterday was exactly how do we ensure that the manufacturers who are already manufacturing do not stop manufacture. It's very important that that happens. And we are working with Gavi COVAX to see how best we ensure that the Aspen factory does not shut down any of the lines. Second is there are a number of countries who have the ambition to manufacture vaccines. The entry point is COVID vaccines, but these are enterprises that can be able to be repurposed or adjusted so they can be able to manufacture other vaccines apart from COVID. COVID was the opportunity, and these enterprises, we are looking forward to them manufacturing different types of vaccines that are required here on the continent and elsewhere as well. So we are working with them to ensure that each country that has the ambition works on a type of vaccine that is going to ensure market is not flooded, and will ensure that the investment that they are making are actually giving good returns when Africa starts manufacturing its own vaccines of all types that we use both in routine and in outbreak prevention activities here in Africa.
Thank you very much, Ahmed. Let's stay online and say hello to Sophie Mukwena, who is with the SABC. Sophie, please go ahead.
Thank you so much. I just want to check the war in Ukraine.
Please go ahead, Sophie.
The war in Ukraine has affected food supply. In terms of medical supply, do you experience any challenges? And with COVID-19 cases rising, are we not going to have a problem as a continent?
No, thank you, Sophie. Specifically on medical supplies, at the moment, there is no pressure that is directly related to the crisis in Ukraine. But in general, the longer that supply chains are strained, then the more likely that it will eventually affect the medical supplies as well. Secondly, is prices are a very complex mix of many different items. And as soon as your oil prices start going up, your transport prices will go up. And that way, prices of all commodities, including medical products, will also go up. So in this way, it does affect as well our medical supplies. But directly for the health products that we use, especially in COVID-19, at the moment, we cannot be able to attribute that to the crisis. But for sure, the energy part of lack of availability of fuel, that will affect prices of literally all products, including the ones that we use in COVID-19 preparedness and response.
Okay, thank you. Staying online still, we have Paul Adepoju. Paul, good morning. Please go ahead.
Yeah, good morning, and thank you very much. And good morning to Dr. Ahmed. I have two questions, three in general, but two regarding in relation to the World Health Assembly. And so firstly, what do you think has been your personal assessment of development at the Assembly regarding the African continent? What do you think has been the best outcome so far for the African continent? The second question is on Sunday, I think, WHO's Regional Emergency Director noted that he was in Ethiopia last week discussing with the Africa CDC's management regarding how to align both agencies' plans in the next 5 years for Africa. And they also saw some similarities in both initiatives. So I want to know whether there are any latest developments regarding streamlining and working together with WHO so that there is better coordination between both agencies. Then my last question regarding monkeypox has to do with the development of monkeypox now becoming of global concern. What does this suggest regarding neglected tropical diseases in general? And do we see these happening to other diseases that are endemic in Africa? And how do you think the world should better respond? Thank you very much.
Thank you. Before you start responding, Dr. Ogwell, we have about 10 minutes left to go, and we have quite a number of questions. So I would ask that your responses be quite brief so that we can take as many questions as possible. Thank you.
Thank you, Wayne. And Paul, in as far as the assembly is concerned, I think it is best to wait that it closes because a lot of the decisions are still sort of waiting for the final decision. But one thing I take away from this assembly is the African region is working even more closely together than I've seen in previous years. In as far as alignment of our work with the WHO is concerned, and this is not only the Africa region, it is also the Eastern Mediterranean region, because 7 of our countries on the continent are grouped with the EMRO group. We are working very well. We had the meeting. We have had 2 other meetings here in Geneva, and we are going to be producing a plan that is synergistic in the coming weeks. So we have gone a step further by identifying what each and every organization's role will be in the larger preparedness and response framework for the African continent. Monkeypox, this is a call that the world is so small today that anything happening in one corner can be able to reach another corner. So the world needs to look at every disease that is transmittable in the same way, that it can be able to be found in another part of the world very easily because travel has become much simpler and faster. So the monkeypox is a good lesson, and we need to prepare for every outbreak in every part of the world in the same way as we prepare for the ones that occur in many countries at the same time, because the risk has become very, very high due to the way in which we engage and we travel.
Thank you. We go to our WhatsApp questions, and we have one from Sarah Jerving, who is with DEVEX. This week, some African nations have objected to the United States' proposed amendments to the international health regulations. Does the Africa CDC agree with these amendments?
Thanks, Sarah. I'm not sure which amendments you're talking about. There have been quite a number that have been put forward, including by the African region. And we as Africa CDC are fully behind our member states from the continent, both in the African region and the Eastern Mediterranean region.
All right, thank you. We stay on WhatsApp and say hello to Cara Anna, who is with Associated Press. She says, thank you for this briefing. And she wants confirmation that the monkeypox cases that you mentioned in the 4 countries this year are not linked to the ongoing United States and Europe outbreak. And also, she says, were the smallpox vaccines previously used in monkeypox outbreaks in these or any other member states of the African Union?
Now, thanks, Sarah. The second question first. Yes, we have been using the smallpox vaccine to handle outbreaks of monkeypox across the continent previously and even now. And in terms of relationship between the endemic variants here on the continent vis-a-vis what we are seeing elsewhere, the sequencing has not yet given us any direct link. In fact, some of the cases don't even have travel history at all. And this is something we are still waiting for data to come back to be able to give clarity of the source of these outbreaks elsewhere in the world. So our laboratory scientists will be able to provide that in the coming days.
Okay, thank you. It's time for us to say hello to Lucia Blanco from the International Spanish News Agency in Nairobi. She's asking also about the smallpox vaccines, and she wants to know whether they are being administered to the general populations in those 4 countries with active cases, or are they only being applied to the health workers? And then she also goes on to say, and why are the stocks so small? And is there enough production of the smallpox vaccines globally to cover the needs of the many new countries that are registering new cases?
No, thank you, Lucia. The prioritization is first health workers who are in the front line, and then the affected communities where the outbreaks are first characterized before contemplating the general public. We do not have yet enough stocks to be able to go into the general public. The focus is the health worker, and then after that, the immediate population that is at risk. In as far as stocks are concerned, this is always a challenge of manufacturing in the right quantities and need. At the moment, the need has not been very big, but as it spreads across the world, then the need becomes higher, and therefore the small stocks become very valuable. And we are looking forward to the manufacturing institutions continue to manufacture more so that we don't end up with a situation of scrambling for the smallpox vaccines that are in stock.
Thank you. I'd just like to ask our administrator, please, to deal with the background noise that is interfering with the sound. All right, I think the last question that we have is coming from, again, from James Macharia Chege, who is with Reuters. And he's saying in countries where the monkeypox is endemic, do health authorities use drugs or vaccines to control outbreaks there?
Thanks, James. Number one on the list to control the outbreaks is actually non-pharmaceutical measures, ensuring that the cases have been properly isolated as they are being managed, informing members of the public how they can protect themselves by not coming into contact with a person who has similar symptoms or animals that could be the potential source. And then after that, those who have been affected are then treated, and treatment, as you know, is very supportive of the immune system, not really specific treatment for monkeypox. And finally, the vaccines come in for the health workers and the population that are at risk. So vaccines come a little bit later in the chain. There are other non-pharmaceutical measures that we can be able to put in place without having to go to vaccines, because those are not as available as we would want them to be. But going forward, and with all the lessons we have learned during COVID pandemic, we are organizing ourselves to ensure that all the tools that are needed for response are in place, and governments can be able to make those available to their populations that are at risk. Let me add here that don't go out looking for a vaccine if you're not at risk, because that only puts pressure on those who are at risk. It really needs to be well guided by governments at country level.
Okay, one last question, please. Sarah Jerving again comes back and she says, which amendments to the IHR have African nations proposed?
No, thanks, Sarah. To the best of my knowledge, African nations are at the moment providing the feedback to the Assembly that it may not be exactly the time to amend the IHR. They have not come up with any new proposals to the best of my knowledge. They are projecting the message that the time now is not for amending IHR. It is to try and make it work. And if anything else is needed, then it will be something that a legally binding tool will be more preferred rather than spending the time amending the IHR. To the best of my knowledge, this is the discussion that they have been having, but as I said, the assembly is still on until tomorrow. Let's wait and see what the final messages will be from plenary regarding the issue of amendments to the IHR.
Thank you very much. I think we're coming to the close of our briefing for today. But before we do that, please give us a roundup of your main points that you want colleagues to take away from the briefing today.
Now, thank you very much, Madam Wayne. The three key messages that I would like us to go away with, one is that vaccination is still low, and we need to work even more closely on the continent to be able to provide avenues to increase the vaccination rate from the 17% as we aim for the 70%. Second is that smallpox has been endemic on the continent for decades now. We know how to deal with it. We are supporting our member states to deal with it, and we are happy to share that knowledge, the experience, and the skills we've built over time with the countries that are seeing monkeypox now. Third is that there is need for all those players who are in the business of procuring particularly COVID-19 vaccines, but all vaccines in general, that the procurement is done of manufacturers who are coming from Africa first. This is a clear message from our heads of states from their May 10th meeting. And this is a message that we want to continue to project, that whether it is Gavi or UNICEF or COVAX or the philanthropies, buy from Africa first, and then you can be able to purchase from other parts of the world. Thank you.
Thank you very much. That was Dr. Ahmed Ogwell, the Acting Director of the Africa CDC, covering a range of topics, COVID-19 plus the monkeypox virus, which many of your colleagues are concerned about. And he will continue to do that next week on Thursday at the same time. So please join us then. And I want to thank you very much for your attendance, as well as thank Dr. Ogwell and my colleagues behind the scenes who are making sure that we are able to connect with each other. Till next week on Thursday at the same time. Bye-bye for now.